Hello everyone. In this video, I will be discussing regarding the frequent doubts which the patients have after a VP shunt surgery. VP shunt surgery is a very common surgery which is being done, which is done by me. It's usually done when there is a condition called hydrocephalus, that is when there is excessive accumulation of fluid within the brain. This fluid is called cerebrospinal fluid. So if you are watching this video, I assume that you have been advised a VP shunt surgery, or you have already underwent a VP shunt surgery, and that is why you are seeing this video to understand the various doubts which you usually have. Okay, let me tell you the frequent doubts which my patients have. The frequent doubts which they have is, the first one they ask is when they can start showering or taking bath. Second one, when can they return to their activities of daily life? Third one, what physical activities are they restricted? Fourth one, can they exercise or not? Can they drive or not? Most important one, when can they go back to their work? And when can they travel? And also they keep asking me what are the dietary restrictions which they have. Okay, so let us answer these questions one by one. First question, as soon as we discharge the patient, the first question which they ask me is when can they start taking bath? So usually until the suture removal is usually done somewhere between 7th to 14th day. Until then, we ask the patient to take care of their incision sites with regular dressing and to avoid showering. They should avoid wetting the incision sites. That is over the scalp where the incisions were taken and also over the abdomen. But over the other sides, they can use a wet towel to gently mop the area. So they need to maintain hygiene, but at the same time, they should ensure that the incision suture sites are not wet with water. But once the sutures are removed, after 3 to 4 days, they can take their regular bath with a mild soap, or you can use a baby shampoo, which is much safer on the incision sites. So probably my answer is clear. You can start showering once your sutures are removed. 3 days after it, try to shower with a gentle detergent like a baby shampoo. That's it. Let's come to second question. The activities of daily life. When can they do their regular activities? Usually by the time the patient is discharged after a successful surgery, in more than 90% of the patients, the patient will be fully awake. They'll be normal. They'll be conscious. If there is no other injury to the brain, usually they'll be able to carry on all their activities of daily life by the time they reach home. Then, next question, are there any restrictions in the physical activities? Definitely, there are some restrictions in the physical activities. What? Shunt is a pipe. You can imagine it's a small pipe which is bypassing the obstruction in the brain, diverting the fluid in the brain from the brain into the abdominal cavity. You should avoid all those activities which can put pressure on this pipe. This shunt is under your skin, so it's not visible. So avoid those activities which may constrict the pipe. That is, avoid dresses or any clothing which is tightly putting your neck or the abdomen, which can compress the shunt. You are not supposed to lift weights which are more than 5 kgs in weight. Avoid contact sports. Avoid heavy physical activities. Your daily routine work, you can do it unrestricted. Non daily routine work, mild physical activities is always encouraged. So what is the physical activity which we encourage? We encourage the patient to walk about for half an hour to 1 hour, at least 2 to 3 times a day. This helps in making you feel good. It helps in early recovery. It prevents a lot of complications like pneumonia, deep vein thrombosis in the legs, bed sore, and all these activities. So advise the patient to walk at least half an hour to 1 hour, 3 to 4 times a day. The patient can walk about within the home, but it's better if you walk about around the home in a garden or on the terrace of your home. Can the patient drive? If the patient is still drowsy, obviously patient should not drive. If the patient is taking painkillers, driving is restricted. We don't advise the patient to drive because some of the painkillers can cause drowsiness. So if the patient is fully conscious, if you have gone for a review for your patient, and if you are with your doctor, and if a doctor feels that the shunt is fully functional, then you can start driving once you are off your painkillers after 4 to 6 weeks of the surgery. But if it's possible, try to use a public transport like a bus or a cab. These are more safer than driving yourself. So when can you go back to work? The same conditions apply. You should be fully conscious. Your doctor should have seen you and he should have felt like your shunt is working. That is, there should be no symptoms or signs of shunt malfunction. You should not be having any seizures, and you should be off your painkillers. When can you go for a travel? After 4 to 6 weeks, the travel restrictions are about it. You can travel by bus or a train or a car. But before traveling by an aeroplane, do consult your doctor to ensure that you are fit to travel by air. And two important things. When to contact your doctor? What are the symptoms or signs? You need to contact your doctor under two conditions. If you feel that the shunt is not working, either if it's under draining or over draining, or if it's blocked. The second condition, when the shunt is infected. These are the two common conditions where you are supposed to meet your doctor immediately. So what are the signs or symptoms of shunt malfunction? The patient may become drowsy. He can have persistent headache, which is diffusely situated over the brain. He can have blurring of vision, a double vision. He can start having vomitings. Vomitings are usually not preceded by nausea, but not always. If the patient has these symptoms, then immediately consult your doctor who will examine you, and if required, he will investigate you with a CT scan to confirm whether the VP shunt is working or not. Second condition, if the shunt is infected, that is, if you're having persistent fever, if there is any pain or tenderness along the shunt track, the shunt moves from behind your ear over the neck into the abdomen. So if you have any tenderness or pain over the shunt track, if there is redness, which are signs of inflammation of the shunt track, if the incision sites have become red, or if there's a discharge of fluid or water from the or pus from the incision sites, these are symptoms of shunt infection. In these conditions, you should reach your doctor immediately. So, hope I'm very clear. I've answered majority of your doubts regarding the care which you need to take after a VP shunt surgery. If you have any doubts, try to contact me on the number given. Try to message me on WhatsApp. Thank you.